We are not here as humans to accept this as a new normal because, again, this is going to kill us. Once you go there, once you do it, once you kill your boys, you can't rebound from it. All right. Welcome to another episode of the Jacque Show. If you are watching this, I don't know what's happening with my weeping windows up here, but it's all eyes on me. It's like a cropped focus on me. But what are we going to talk about today? We're going to go controversial today because quite honestly, I'm just getting sick of it, getting sick of skirting around the issue. And what we're going to do is we're going to approach this from a scientific standpoint. We're going to approach it from the doctoral standpoint, a hormonal standpoint, and also the standpoint of being a father. So we're going to cover all of our bases here. The point of this is to be inflammatory enough to you that you want to do more research and that you want to think a little bit differently when it comes to what's happening with our kids. Now, initially, I recorded one of these podcasts and I had to re-record it, and today is the re-record of it. And I'm going to try to leave the emotion out of it, but I'm going to be honest with you. If we keep going the way that we're going, we're fucked. As a species, as a whole, as human beings, that's it. We're done. And what's happening now with the trend, because that's what it is, it's trending to become more popular, more people are doing it, people are finding their significance by having their kids do this, is this transition between male, female, female, male. And this controversy of you get to choose your gender, which, I talked with my wife about this. The stuff that we talk about in 2022, I never would have thought would have been a topic of conversation ever at all in my life. The fact that we're still trying to figure out and or define what a woman is and what a man is just proof that we're going backwards in humanity. If there are aliens out there, they're probably laughing at us right now. Like, what the fuck? What are you doing? Right? Because think 10 years ago, 15 years ago, if somebody came to me as a doctor, 10, 15 years, I wasn't in practice, but 10. You go into a doctor's office, right? And you bring your kid in and you're like, listen, little Johnny over here, no offense, buddy, Johnny. No, little Johnny over here is confused. He thinks he's a girl. He doesn't know if he's a girl. I don't really know what's going on. From a doctoral standpoint, each male and female are born with a given set of hormones. We have the same hormones between male and female, it's just different levels, okay, of what's normal, what's abnormal. Back then, when science and doctors maybe cared a little bit more, you start questioning, well, how did this come about? This is a symptom of some sort of body physiology issue. Whether it's a mental thing, you have a daughter, an older daughter, and you pay more attention to your daughter than you do your son. So your son sees that you're paying attention to the daughter more. So then if he acts like a daughter, then he's going to get more attention like the daughter does. Right? It's a possibility. Or you have a split relationship. Husband's not in the picture. And then that boy does not have a principled system on what it takes to be a man. And in fact, if you bring in horrible people into your life as a replacement for their father, whether they were horrible or not, you're painting the picture of what a man is supposed to be in a relationship. And then if they're all horrible, then they're like, well, I don't want to be like that. I want to be more like you, Mom. I want to be like you, Mom. Mom, I love you, Mom, which is cool. But, and again, there's nothing against divorce and things, but we have to be present. This whole dad being out of the picture thing, it's an embarrassment for society. Step the fuck up. Man up, and if you're going to have a child with a woman, man up, be there. Set a good freaking example for your kid. I don't care if you can't stand your spouse, be there for your damn kid, okay? Anyways, getting back to the hormonal standpoint of this, okay? So that's the emotional side, right? It's the emotional side of this coming out. Well, I can't wrap my brain around some of the stuff that I'm seeing and some of the propaganda that I'm seeing that I'm not going to talk about today, but it's disgusting from what I'm seeing online. When we have children who are born, we have our chromosomes, right? The chromosomes are what differentiates us between boy and girl. It's as simple as that. If you're born with a vagina, you are a girl. If you're born with a penis, you are a boy. End of story. I don't give a shit what you feel further down the line. That's clinical. That is an issue. That is a brain chemical or a hormonal insufficiency that's taking over in your body. And in society today, all right, we see a lot of feminization of men. And we're like, well, how is this happening? And they're like, well, it's always been around, right? That's the whole thing. It's always been around. It's just a lot more accepted now. Bullshit. We have so many estrogen mimicking chemicals from our plastics, from heating up the plastics in the microwave, from soy that's entering in all of our food, from all this horrible stuff that we have that's increasing estrogen up in men. And then we're stressed, which is going to tank our testosterone. So our hormonal imbalance is going to push towards estrogen. What else? Standard American diet. What's that going to do? The primary food table is you want to make sure you get all of your carbs. That's your biggest category head. I want you to eat all of your carbs. Be a good boy. Eat all of your carbs, right? What's that going to do? It's going to take your testosterone, boom, break it into estrogen. Oh, you're depressed, works hard, drink alcohol, boom, there goes all of your estrogen. The feminization of men is also in turn cueing women to that, like, hey, we're surrendering, we're waving a white flag right now. You're going to have to be more masculine. Then we're having this rise, this tide of more masculine women who, kudos to them, they're getting out there, they're being entrepreneurs. My wife is one of them. She's awesome at stepping into her masculine, but you have to be able to step back into your feminine, where you relax, where you recover. Because if you continue to be in the masculine for too long, your hormones are going to reflect that, and it's going to make you the ultimate alpha that we don't want you to be, women, because it's not healthy for you. No offense, but it's not healthy to stay there long term. You have to dip in, dip out. Just like men, we have to be in tune with our feminine, but we can't just live in our feminine all day, every day. It's not acceptable. What's really concerning me is when I see what's happening, I'm just going to say all over the world, because it is, where supposedly, I don't trust the news sources, but when stories come out, I'm like, you got to be kidding me. So I'm just going to address it, where somebody was going to get Child Protective Services called on them because they were unwilling to medically castrate their child. And they called CPS. How dare you let them do that, right? These kids, okay, these kids are like 4, 5, 6. I mean, my son wants to be an astronaut, a dinosaur, a minion. He can't even figure out what he wants to be for Halloween. He couldn't figure out what he wants for his birthday. The fact that we're allowing minors to decide what they do before they even hit hormonal maturation is insane. And it's deadly. And that's my point here today. It's deadly. It's going to kill your kids. And as a society, if we continue this and we medically castrate our children, or we allow these sex changes to continuously take place, there you go, Bill Gates. Way to control population. And you made it an emotional issue so that I can't say I don't agree with that, or else I'm an asshole. Or I'm a white supremacist Trump supporter. And we don't want to be the white supremacist Trump supporter, so we just shut up and we're like, oh, okay, you do your thing. Kill the kids. Yay. You know what puberty is? Puberty is where your hormones start to freaking change, right? We have different parts, but kids get along like super well. Well, for the most part, I mean, kids are kids, but boys and girls will get along super well, right? And then a boy will hit puberty, girl will hit puberty, and then they start fighting more, right? Why? Their hormones are no longer in sync, right? Girls start to get their menstrual cycle. Boys, you are a boy And if you ever had a menstrual cycle, it's called rectal bleeding. You don't have a vagina. You are not menstruating. Therefore, you are not a girl. You do not have the ability to be able to carry a child. If you do, it's an alien baby that you made in a freaking test tube that you shoved up your ass to birth out later. Not right. Okay. That second part of it, I don't know if that, who knows? That's probably going to be what people say. Oh yeah, you can do it. No, you can't. Okay. Or you make it a girl into a boy, but you don't take out her reproductive organs. So then that gets, they get pregnant. So technically she identifies as a boy. So she had a girl. It's insane. When we talk about the hormones and the fluctuations, right? Men are going to push up their testosterone levels. Women are going to develop their progesterone, which is going to cause their cycle to start. You're going to get your estrogens that are going to take place as well. So from puberty, boys and girls go their separate ways on hormones. Okay. Now I wanted to get the actual average here. So typical time for puberty, and this is definitely decreased from when I was a kid. Puberty starts between the ages of 8 and 13 for females and between 9 and 14 for males. So why the hell are we allowing children that have not even hit puberty yet? They don't even know what their hormones are capable of yet, but we're letting them hack up their freaking genitals so that they can be a girl or so that they could be a boy. Right? And to me, from what the media and everything is showing and the majority of what I'm seeing, it's men transitioning into women. Almost entirely. Which to me, it's awful strange. I don't see as many women trying to be men. There's lesbians and things out there, which is fine. But the transitional thing, it's just, to me, it just piques some interest. Like, why is it that the men are turning into women? That's very strange. When it comes to this, right, we talked about the medical castration. So they give you a medicine to basically kill your testicles, right? Medical castration. Do you think, using logic, do you think at any level that is healthy? What if I gave you a medication that just shut down your thyroid? Just because you decided that you didn't want a thyroid. I'm going to kill that. Right? There's actually medicine for it. It's radioactive iodine that kills your thyroid, right? That's actually a thing that's there. What if I was like, you know what? I don't like my left arm. I'm going to take a medication to kill this left arm. So that way it just falls off. I don't want to even use it anymore. I want to paralyze. It's just a pain in the ass. It just hangs there. It doesn't serve a purpose. I'm right-handed anyway. So I just want this one dead. You would look at that person and be like, what's wrong with you, dude? Like, or dudette? What? Why don't you want that? You kind of need that. Like, you do things two-handed, right? I don't think you understand the necessity of having that extra arm. Just like a little teeny tiny boy does not understand the necessity of having testicles. And then from a doctoral standpoint, when the child does go through puberty, right, you're shutting down that boy's ability to be able to produce proper testosterone, which means we're not going to have muscle mass. Low testosterone leads you to a higher risk for heart disease, heart attack, strokes, right? And then a serum level below 400 is associated with, drumroll please, depression, anxiety, suicidal thoughts. And I can speak volumes to that because I had incredibly low testosterone. And I know all of those feelings all too well. It's not something that I talk about all that often. People know I've had low testosterone in the past, but obviously I've corrected it since. But we're doing this to our children. And then we're saying that the bullying of children who don't understand, they're normal children, they don't understand why somebody would want to change that way. They're saying that the bullying is what's doing that. It's what's causing them to commit suicide. No, hormonally, they cannot handle any type of outside stressors. They don't have the chemical composition to do it. You killed their testosterone. Okay, and if you want to try to feminize them even more, if you want to raise their estrogens and do all this stuff, or you want to put fake boobs in, you want to get some implants, how much have we seen? How many influencers, how many actors actresses have you seen that had to get their breast implants out because they had breast implant illness? Right? So we're medically castrating our boys because they don't understand, because the parents don't damn understand, and the parents should be sent to jail, in my opinion, if they do this to their children. That's the truth. They should be. This is child abuse, 100% all day, every day. And this is emotional. It's doctoral. It's educational. It's scientific. It's fucking fact. And if you don't like it, I honestly don't care at this point. The information needs to get out there, because the machine that keeps pushing this to like, hey, you need to do it. You need to let your kid be. You need to is fucking disgusting. It's disgusting. So when we come back to the hormonal piece of this, right? What about girls who are like, well, I don't want to be a girl anymore. I want to be put on hormone replacement therapy. I want to start to be alpha, right? So we start cranking up their testosterone, right? And we shut down their cycle. We don't want to cycle. Just birth control that. Let's go over here and let's give you a shitload of testosterone. What's that going to do, right? Bioidenticals. There's plenty of research on this. I think it was back in the 80s or so, 80s, 90s, that this stuff was coming out. These bioidentical hormones were coming out. They were slapping people on them, and the rate of cancer went through the damn roof. Through the roof. And so they're like, what's happening? They're like, well, we're using synthetic hormones. They're not even bioidenticals, really. We're using synthetic hormones. And what's happening is our bodies are like, well, I don't know what to do with this stuff. And then it starts to increase your cancer rate, reproductive organs, breast cancer, et cetera. And they're like, oh, shit, what's happening? So you're going to put, again, if you put a girl on it, it's your bioidenticals, estrogens, et cetera. But if you put a girl or a guy, really, testosterone is going to be the same thing either way. You put in HRT, okay, or higher dose testosterone over a consistent period of time, you're going to cause an increase in clotting factor, an increase in fibrinogen. So your blood's going to get thicker, okay? Plus you're injecting, okay, every week, every 2 weeks, whatever your every two times a week, et cetera, whatever your program might be, or you're taking oral skosh, which is going to tax the liver further, right? And a birth control is going to damage your liver. It's going to damage your digestive tract, damage your brain, increase conversion of testosterone to estrogen. So that testosterone you're taking going to get created into estrogen, which you're going to be like, oh, I'm taking more testosterone to rebalance the estrogen. You're like, well, I need more testosterone. And your body's like, well, I'm going to make more estrogen. And you're never truly finding the underlying cause of why. The blanket statement of 2020 to 2022 is, what the hell are we thinking? Where do the doctors go? I'm sitting back for this one because it's just ridiculous. Where'd they go? The Hippocratic Oath. Okay, it's an oath that medical doctors, people are supposed to take prior to treating patients. And the first thing is, first, do no harm. If you're cutting things off, ripping things out, reconstructing the genitalia, mutilating it, or you're throwing in fake breasts, causing breast implant illness, tell me, what about that is not breaking that Hippocratic Oath? Oh, wait. It's all doing it. It's all breaking it. As doctors, we need to understand what is going on, because this, and I'll lean in for this one, is not normal. It is not healthy. We are not here as humans to accept this as a new normal, because again, this is going to kill us. Once you go there, once you do it, once you kill your boys, you can't rebound from it. All right. And it's still new enough that I can't tell you what a life expectancy post transition is, or what's the rate of cancer for those who did transition. But what I can tell you is from logic and from previous studies that depression is going to creep in. They're not ever, your child will never, ever hit their 100% potential. Never. And as a parent, you're doing that. Never. I don't care what you emotionally think, they will not. Because you're altering their hormones, and by altering their hormones, you're altering who they are. And I say by you altering their hormones, because they don't know. As parents, we need to protect our children from what they see, from what they hear, from what they experience. Let them experience the crazy in terms of like the dangerous stuff to a certain extent. Experience danger at a certain level of control. Don't let them jump off the second story of a building like, yay, and let them learn a lesson that way. It's not going to turn out really well. But basically, you might as well do that if you're going to be medically castrating your kid. Let your kid get to that level of hormonal maturation when we hit puberty. And for puberty, I've said this in a million podcasts that I've done, the first thing that we should do when boys and girls hit puberty is map out their hormones. Map it. Why wait for there to be a problem? If my daughter had any issues with her menstrual cycle, which she won't because we're taking care of her, I know what to do. If she ever had problems with her menstrual cycle, I wouldn't say, you know what, she's acting like she has some toxic masculinity right now. Hey, Sage, do you want to be a boy? Is that what you want? Do you want to transition? Do you want to be a boy? Or if my son was acting like, hey, Hoyt, do you want to, would it be easier? Do you want to be a girl? Right now, I can go do the surgery and, we can potentially see if we can get an insurance to cover it because it's ridiculous. And why insurance covers that, I still have no idea, but they won't cover functional medicine. So would that be easier? Would that be good for you? Right? Even then, when they hit that puberty, it's not going to make any damn sense to them. And it shouldn't make any sense to them because it's not normal. It's not normal at all. You analyze the why. You analyze the cause. If somebody comes in for depression, you don't just slap them on a damn medication. I know medical doctors do. I will never, ever allow that to happen under my watch. If somebody comes in with some sort of a mental illness for me, you better believe I'm going to search high and low to find out that root cause. Figure it out. Is it some trauma that happened when you were a child that you never processed through? When was the last time your damn doctor asked that? Never, right? What about, are you just eating horrible food all the time? I'm angry. Well, stop drinking, stop eating gluten, stop eating dairy, and see how you feel. Hey, doc, I feel great. Of course you do. Your brain's not inflamed anymore. Guess what? Your mood is going to be better. Why? Your brain's not inflamed. When your brain's inflamed, you're going to have headaches. Your whole conscious thought is going to be rattled. The standard, everything that gets promoted to us, the standard American diet, the standard American work week, which is, again, BS. All of this, all of the stress, all of the education, all the indoctrination from a tiny age child getting into school is designed to make us sick. Every single year, we hear something that is more and more ridiculous when it comes to your health. First, it was COVID. And now they're trying to backtrack, and Fauci's like, well, we didn't know what the details were on we didn't know that it really wasn't that deadly. Bullshit, dude. Bullshit. We all knew that. We knew who was at high risk. We knew what the hell was going on behind the scenes. Fucking apologize for ruining it. We have a record level of homeless people now due to your damn policies. Own up and get the hell out of here. Why you're still out in the country, I have no idea. That was the start of it. And then we had more motivational things. Now we have another topic that I'll talk about at a different time, abortion. That'll be a nice controversial topic. But now we have this whole gender fluidity confusion. We have cross-dressers in the street. We have strippers doing stuff with children being present. This is disgusting. And it's indoctrination because they're trying to push it down our throat that lifestyle is normal. It is not. Just like they're trying to normalize pedophilia, this is in the same vein of that. It is. Almost even worse, because what's happening is we're fucking up our children. We're ruining their lives. Ruining. Nothing positive. Nothing. And I will lay down my life on this. Nothing positive happens through transition. Nothing. Nothing. You look long-term? Hell no. What is long-term for them? Who knows? It's not going to be very long, though. And at some point, that depression is going to creep in. They're going to be on antipsychotic, antidepressants. They're just going to be fucking vegetables who can't live in life anymore because you fucked them up as a child. We have to understand if our children, if our teenagers, if our friends are presenting with symptoms that are not clinically normal. It is our responsibility as parents, as friends, as doctors to step in and say, listen, I understand. I understand what you're feeling. I don't fully understand because I never had those thoughts, but I can understand, listen, you might be confused for some reason, but I can tell you right now, there's a test for that. Doc, I don't know. I don't have the energy. I don't have sex drive. And I just think that, I don't know. I just don't feel like a man anymore. I feel kind of confused. And, I love my romantic comedies, which I love my rom-coms too. We watched Miss Congeniality last night. It was freaking hilarious. Right. And then you're like, oh, well, you know what? It sounds like you want to be a girl. Is that what you want? Right. We're force feeding this diagnosis. Do you want that? Yeah, we can accomplish that. Yeah. Come on over here. We'll kill your boys. We'll put you on these hormones and good luck. Right. No, it's abuse. Find the why. Find the why. There's always going to be a why. Is it from what I said as a child, where they grew up in a household and they were the only boy, 6 girls. All the girls got all the attention of the world. They all felt special. Little Timmy in the back didn't really get that much attention, so they're trying to act as though they're being something that's going to get attention because they need significance. Right? Is it hormones? Are they eating soy food? I'm not going to say no offense. I know somebody who's vegan. I love them to death. But are you putting your kids on a vegan diet where they're not getting animal protein? They're not getting the adequate amounts of protein, the thing that they need, the B12 that they need. Is that what's happening? Are you just pounding down soy? Are you pounding down processed sugar because you don't have time, right? You don't have time to make food. And so you're buying what's easy at the store and you're bringing it in. Here you go, Timmy. Eat this. And at first you're like, oh, I just got a little fatty on my hands, right? Which is going to be another podcast I'm going to do. Bring back fat shaming, which is going to have a different spin to it, but I want it to be inflammatory until I do it, right? Little Timmy he's a little chunker. It's fine. He'll grow out of it, right? He'll grow out of it. It's fine. Then he hits 10. Little Timmy has boobs, little man boobs. How did that happen? Imbalanced hormones, or were you pushing estrogen mimicking compounds in the body? Xenoestrogens. There you go. Increase those. Oh, your little Timmy's trying to produce testosterone, but he's still eating this shitty food. Well, guess what? All that testosterone he's supposed to be producing in puberty is going to go into estrogen. He's going to be fat. He's going to be emotional. He's going to get bullied, right? Which is going to make him emotional again. He's not going to have the physical capacity to get out there and accomplish anything in sports or even be competitive just in nature, just pure estrogen, right? And if you caught a theme in this, it's the parents. It's the parents. You have the choice to make your child healthy. You have the choice to make sure that their hormones are good. You have the choice to allow them to get to puberty and help them through puberty. That is our job. It's what we signed up for. If we're not capable of it, or we're one of these parents who are trying to get popular on TikTok and doing these gender announcements, hey, my kid's transgender, look at me, woo, pop it, and you get 15 million views and you get paid from TikTok. You basically just prostituted your child so you can get paid on TikTok to be a fucking asshole. Right? Are you one of those parents? You're not present. You're not there. You're not setting good principles. You're not setting good behavior. You're not teaching them what it takes to have the masculine and feminine dynamic. You're just letting shit run wild. You're not there for them. You're on your phone too much. You're scrolling too much. You barely have time to make dinner. Quote unquote, you don't have time to make dinner, but you're scrolling for 6 hours, 7 hours on your damn fucking phone. Right? I can check. I can't check it, but you can check your own phone usage. How many hours a day are you on that damn thing? I guarantee it's multiple hours. You tell me you don't have time to go to the gym. You don't have time to set the example to say, hey, we go to the gym because it's healthy for you. Hey, we're going to stay up till 11 o'clock, 12 o'clock at night watching movies all night, every night. And then your child is up there and he's like, well, can I hang out with you? And you're like, yeah, come on down. They're up to 11 and 12 o'clock at night. And guess what? Those who sleep less than 5 hours a night, okay, reduce sleeping, increase your risk of type 2 diabetes. Good job. Great parenting, guys. This isn't a personal attack. This is stuff that we see. This is stuff that we hear. This is personal responsibility. This starts as a foundation as a parent. And again, I don't care if you guys have been divorced. I don't care if you guys are still together. Make sure that you have a united front on the health aspect of things. Make sure you have these conversations with your kids. I don't feel as though we should even need to have this conversation right now with our children. And I'm going to be honest with you. I don't talk about this with my kids. I don't think they are emotionally capable of handling what it is that's out there. And I'm not going to explain it to them. I'm not going to do it until they get to an age where they see it themselves and they come inquisitively and ask and say, Dad, what is that? What is that? And then I have to go into and explain it. And I say, that's a clinical disorder that went undiagnosed. And potentially, depending on how old they are, potentially a parent fucked up. That's what that is right there. There's no mulligans on that. There's no do-overs on that. And then you're arguing, oh, insurance should pay for that? Get the hell out of here. Get out of here. Might as well just call back Dr. Kevorkian and say, hey, bro, like, I liked what you were doing back there. Let's do it like this. Like, you're doing the same damn thing. It's just a slow, miserable death. It's like chemotherapy for cancer. It's not going to fucking work. It's going to make you miserable for the last years that you have in your life versus switching and redoing how you got sick to begin with. There's a lot of stuff in this podcast. There's a lot of, you can sense the anger. You can sense the hostility. You can sense that I'm not happy because I'm not. It's frightening. What we're seeing is absolutely frightening. I care deeply, deeply for humans, for human beings, for kids, especially when you have your own kids. I mean, good Lord, the amount of love that you have for those little jack wagons. I'm going to call them jack wagons because they can be jack wagons at times, but you still fucking love them. They shouldn't have to deal with the stuff that is out there right now. Whether, again, it was the COVID masking and gagging our kids, okay, or having other agendas shoved down our throat at school, or this stuff. We're trying to have pride parades and all. That's fine. If you want to do that, cool. If you want to be trans, I will not agree with you at all. We will have zero in common on that. However, if you're just a good person, though, I'm not going to say, hey, I'm not going to say hi to you. I say hi to freaking everybody. I waved to people. I was walking down the street yesterday to go to the park with the kids, and I'm waving at random freaking cars. I can't even see who the hell's in there. I'm just waving. I'm like, hey, I hope this makes somebody have a good day. Hey, there's zero long-term judgment on that. I'm telling you that I will not teach my kid that that's normal. Nor will I teach any of my patients that that is normal. And if you came to me and that was your clinical diagnosis and you had no idea what was going on, I'm going to do everything I can to fix that for you because that's clinical. It's clinical. It's clinical. It's clinical. There's something wrong. Just like depression, there's something wrong. It's not that you lack a medication. It's not that you have these problems because you have balls or because you have boobs or because you have a vagina. No, that's not it. There's something else going on. And it's severe negligence on the parent and, by God, on that doctor that is doing this. And how they sleep at night, I have no clue on that. But what I can tell you is, emotions aside, if you choose to do this, do research. There is no research on what happens when a kid goes long-term transgender. It's just not there. It's too new of a thing for there to be a 5-year, 10-year, 15, 20-year study on this stuff, which is usually when published research comes out, give it about 20 years or so, go through peer-reviewed literature, make sure you do the proper trial, you do long-term analysis. We're talking 10, 20 years. But what you can do is use logic and say, well, what happens when we put just regular adults on hormones? Really antagonistic hormones, right? Hormones that are not supposed to go high in your body. What happens in a woman? High rate of hyperandrogenism, right? PCOS. We can convert too much and make endometriosis, cause infertility. So again, if at any point they wanted to kind of reverse this stuff, you're going to have polycystic ovaries, you're going to have all this stuff, you're going to have insulin resistance that's going to creep up too because the stress, the cortisol release, as well with having your body kind of being in chaos, you're going to be in fight or flight a lot of times. And what's going to happen? Your thyroid is going to be confused, right? Because if you alter one chemical in the body, just one, everything else in your body is going to be altered. You don't believe me? Alcohol. Ethyl alcohol. You drink alcohol, what happens? It's not just your liver that feels funny. Your whole body feels funny. What about cannabis? It's not just your head that feels funny. Your whole body feels funny. What about psilocybin? It's not just your head that feels funny. It's your whole body that feels funny. Feels different, right? Our body is made of specific chemicals. And when we add something, we shut pathways down, we open pathways up, and our body has to adapt to those new things. The adaptation is sustainable for a certain period of time, but then more disease is going to set in, more difficulties are going to set in, and it's just going to keep getting worse and worse and worse because you committed. This stuff is clinical. We have to make sure that we figure this out. We have to get to the root cause because for all of humanity, we have to. We have to. We just do. How are we supposed to continue on as a species if we've got these gender confused individuals? They're doing these changes, these sex changes, right? And think about dating. Yeah, I'm gonna be asshole-ish here. How the hell is my son and daughter, or my son and daughter going to figure out if it's a boy or like, that's ridiculous. You shouldn't have to open a surprise package when you get to that age. You're way too young for that, but like when you get to that age, you shouldn't be like, "Ooh, I don't know what I'm going to get." And just really rolling the dice here. What are your pronouns? Fuck you with your pronouns. I'm going to leave that in there too. You're a boy or girl. You want to call yourself something different? That's on you, dude. But again, that's clinical. That's clinical. Find out why your mind is set that way. Turn off the damn news, turn off the damn social media, figure out who you are, figure out why you feel a certain way, and correct what's abnormal. Because it's abnormal. Look at the long-term studies for testosterone usage. Just look up the medications that they give these children. Look it up. Look at how it affects adults. And children are like little mini adults. So it's going to affect them even more. Right? So if it's horrible for an adult, what the hell do you think it's going to be for a child? A miracle? Hell no. Right? Or mutilation of organs. Or look up breast implant illness. Come on. Like, it's there. The thing around this is this whole thing is blown out of proportion because of an emotional set of people being completely irrational and wanting everybody to accept that as true. Trying to teach that in schools and have like pride, like, no, that's clinical. Figure out why. Otherwise, we're screwed. As a human race, as a population, we're screwed because we're not going to be able to have children. We're going to have an increase in stress. We're still going to keep eating the xenoestrogens, right? We're still going to keep doing all these things that are making us sick to begin with. And if doing a sex change, you think that's going to work, it's going to speed things up in the wrong direction because it's not natural for you. It's not natural. And you're trying to force it, right? Because if it was natural, then you wouldn't have to take those blockers, right? You wouldn't have to get medically castrated if this transition thing was natural. If it was a normal thought, oh, shoot, okay, we'll just start thinking that way now and your body will do. No, your innate intelligence inside your body is like, what are you doing? And you're like, well, I'm going to pour chemicals in here to make sure that I don't identify that way anymore. Chemicals, 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 chemicals. Right? So then are you actually what you're transitioning into? Or are you chemically altered to be what you thought that you wanted to be? It's a solid question. Because if I have to dose you on chemicals your entire life to make you the opposite sex, guess what? Surprise! You're not the opposite sex because your body knows better than you. Sorry doctors, sorry parents. These bodies, way smarter than any doctor that's out there. Way fucking smarter. We have no idea. Like we're like, oh, the body's made out of atoms, and now quantum physicists are like, no, we're energy with like 0.002% matter, just debris. We're like dust. We're dust in the wind. All we are is dust in the wind, right? And we're finding out more like, I don't know. There's a subconscious. There's a conscious mind, and there's you do this, and every like 5-10 years, we're like, we were wrong on that. Now we're over here. This is something that needs to stop now, because I can tell you it's not gonna improve. Technology's not gonna improve. We're not gonna just start slapping on prosthetics and things. Like, no, this is a clinical issue that needs to be solved, or else we're just gonna keep getting sicker and sicker, and our rate of cancer, heart disease, diabetes, all of this stuff is going to continue to get worse. It is. So I'm trying to do this as a public service announcement. I'm sure maybe not, because my followers know how I speak at this point. Hopefully you listen the entire way through. If you're a new listener and you're like, I don't like this guy at all, then that's fine. I'm not the right podcast for you, because I care. I care deeply. I do. That's why I get so fired up. That's why I drop more swear words on this podcast than I think I have in maybe the entire culmination of all of my podcasts, 50 some episodes, because I care. And I just think that this is getting a little bit out of control. Try to bite my tongue for a while. Try to approach it with some science. Try to approach it from some reasoning. At the very least, if you're like, well, I still want to do it, let your kids hit puberty. Let them hit puberty and see how they change. Just let them hit puberty. Let them get there. Let them get to puberty, see how they change. And if it's still the same, test their hormones. And if their hormones look perfect and they still want to change, I don't support it, but at least you checked. Right? There's still some other stuff that's going to be going on that you're going to miss, but at least get to puberty, test the hormones, and see where they are. It's the least you can do for your child, right? And if you're an adult and you're like, well, you keep talking about kids. Yeah, I'm very passionate about kids. If you're an adult, you're your own fucking person. If you want to do this and you want to kill yourself, go for it, bro, or broette. Go for it. I won't support it. I won't call it natural. We can still be friends if you want to. I mean, there's going to be very hard to find things to talk about that we'll agree upon. But I see you, I'll say hi and move along. I'll probably shake my head like, oh, that poor person. They have no idea what they did to their body. So maybe there is a little bit of judgment, but it's judgment with science backing it, actual science backing it. And at some point, there's going to be some regret that creeps in. And we've seen this. We've seen it on social media where people are like, nobody tells you about the long-term damage here. Right? Where what did they do? They inverted, I think this guy's penis, inverted it, and he started growing hair internally, and it got infected. He was on like many, many, many rounds of antibiotics. His whole body was falling apart. Like, again, they can't really properly educate you because they don't know what the hell this stuff does long term. Right now, this is just a fad for people. Doctors are like, cool, I can get paid to do this. This is super simple. Let's do it. And I'll be highly supported by the LGBTQ RST 974 community. Right? Was that an insult? Yeah, kind of. There's way too many of these organizations. Okay? There's way too many of these categories. None of them make sense. A lot of them are clinical. Okay? If you're like, well, I'm gay, I'm a lesbian. Well, listen, that's your choice. If you fall in love with a dude, it's not my thing. But if it's your thing, cool, go for it. I have plenty of gay friends. Okay? Women being lesbians, that's fine. I completely understand your infatuation for women. That's why I married one. Like, I get it. Women are beautiful. My wife is beautiful. I'm not going to judge you for that. But when we start coming out here and we're saying, oh, we need to change. We need to do these transgenders. We need to do that. No. The line's drawn. That's it. You don't have my support. Because now we're talking health. Now we're talking my wheelhouse. So I'm going to shut up from here. Again, hopefully I'll listen the entire way through the podcast. If not, that's fine. But this information needed to be out there and it needed to be abrasive so people wake up. And that's my 2 cents. Thanks for tuning in and talk next time.